Hi Sharks, I'm Shelby. I'm the creator of Devices for You, and we've come up with our very first product called the Lifty Lever. Here's the prototype here, and I'll talk about that more in a second. We've been serving the Western Kentucky area for about 6 months, and I wanted to specialize in making an assistive device for all populations and needs. We currently have 2 occupational therapists and 1 speech therapist on hand to help with the creation of this product, and our goal is to expand our patient safety and comfort by creating a chair lever that is adaptable to all conditions. So we created the Lifty Lever as an easy assemble recliner chair level that fits wooden or plastic levers. And the tools to assemble are all with the lever when you buy it, so there's no increase in cost there either. The lever is durable, made of wood and recyclable materials, and it's easy to use. So the Lifty Lever was conceptualized by me, the sole owner, as I worked in a hospital and witnessed patients struggle to use their levers. In the beginning, I asked my clinical instructor what she would change in a patient's room to make it more accessible to them, to therapists, to nurses, to anyone that comes into that room and has to work with that patient. And she said that the hospital chair levers in the room and the chairs that they use for dialysis and just everywhere in the hospital, they're really hard to use because the levers are so heavy and require a lot of resistance to pull and to push, and they're very low on the chair, so you have to reach down very far, which with patients who have any kind of sternal precautions given, they wouldn't be able to push or pull anyway. But if they have sternal precautions, back pain, arthritis, any kind of musculoskeletal surgery, like mental disability where they wouldn't be able to see it, visual deficits where they wouldn't be able to see it, or have tactile deficits, decreased fine motor, decreased gross motor, it'd be really hard for them to reach over the chair and find it and pull it, even if they're strong enough. So the chairs are really bulky too, and they sit really low because you have to create good ergonomics anyway in the hospital. So that is just another barrier to where they can't reach it. So I wanted to create a lever that was a little bit taller, that could be more of an extension, and instead of pulling this way with the chair, they can push and pull. And this motion uses a bigger muscle group, which also makes it easier to pull. Our mission is to advance human comfort level at home and in a hospital by providing a product that conserves energy and decreases risk of injury. The vision is to create an inclusive device for all populations and disabilities that contributes to their well-being and independence. I want to determine the outcome measure by calculating the Net Promoter Score. You don't always do this for small businesses, but if this product is going to be marketable on Amazon or through any type of drugstore, so people can buy their assistive devices or any assistive device website, or marketable to insurance companies, I want to be able to know what the customer satisfaction is, because knowing what your customer wants and how we can modify it to their ability or disability will help us create more modifications for future projects. So I want the score to be between 30 and 70 by year 3, which is pretty good, and 70 to 100 by year 5, which is excellent. Don't want to be anywhere below good. I also want to start creating a goal for having a product that is recyclable to decrease our carbon footprint, which would also be cheaper because you can make more, and just recycling, why not? And so I researched recyclable materials that don't involve wood, because cutting down trees, we want to try to avoid that. And I found the cocoa pallet. It's made out of coconut husk that have been discarded and don't have any use anymore, and they basically compact it down into a big wooden pallet that can be cut up into different shapes just like wood. So I thought, why not try to make something out of that? And it's bio-based, 100% wood-free, and it comes from coconut husks. But the hardest part about that would be transporting the materials, or like getting them overseas, or getting them from Florida from the trees. The lifty lever is 13 inches tall. This one is, and 6 inches wide. We can, with the modifications and depending on the type of chair, you could make them taller or shorter, wider, or not as wide. The prototype is made out of one big piece of wood, a bracket here, some tape for reinforcement because it's not a very good prototype, a small piece of wood here and a small piece of wood here. This also has a cushy handle underneath that makes it a little bit easier to grasp. In the long run, I want something similar to this, but I want there to be finger grippies on each end, a wider base of support with the bracket. This is a 1-inch bracket, but I want it to be more like a tube that fits right onto the lever, and that way you have more leverage to say. The problem, as we've talked about a little bit, patients with any type of motor disability, or have just gotten out of surgery and can't lift, or have decreased strength, increased risk of falls because they can't get out of their chair correctly, or they can't put down their footrest correctly. Anyone with arthritis that has pain in their fingers and it causes more pain to have resistance, things like that. But it could also be used for any person with a lever chair that just wants an easier lever. The lifty lever is unlike any of the levers you see on the internet now. The internet, when I looked it up, there is not currently a patent that describes something like this. There are other levers out there that are just a tube that extend out, but it's basically just a longer version of the same lever. It doesn't bring it up taller, it just kind of sticks it out farther, and it doesn't help much. When researching how many surgical and patient procedures are performed in the United States, Stanford found that 1.2 million people have nervous system surgeries, 1.3 million respiratory system surgeries, 7.3 million cardiovascular surgeries, 6.1 million digestive system surgeries, 5.2 million musculoskeletal surgeries. That's 21.1 million patients that you could see in an inpatient hospital throughout the U.S. in 1 year. Probably more now because this was a couple years back. All of these patients could have used a reclining chair in the hospital and have a need for this. So for the price, it costs about $5 to make this prototype, and it would be a whole lot cheaper to make one just out of wood or out of the recyclable materials, because you could make it all one piece with one bracket. You wouldn't have to have the duct tape and the different types of pieces of wood on there. You could have just one big piece. So the marketable price is about $19.99. I would need about $10,000 in equipment just to make it, and I need to ask the Sharks for $50,000 just in marketable costs. Thank you.